Did you know that morning coffee drinkers have a 31% reduced cardiovascular specific mortality compared to all-day coffee drinkers? In today's episode, we're going to be discussing caffeine and its effects on cardiovascular health, so stay tuned to find out more. Hi everyone, and welcome back to the Chemist Couple podcast with your hosts Jess and Lee. We're both clinical pharmacists who work in GP practices in the UK. So let's get into the episode. I think we should just go straight in.
Yep.
Obviously, we've discussed in the beginning that we're going to be discussing caffeine and its effects on cardiovascular health. Was there any reason why we wanted to discuss this that comes to mind?
I think because it's the most popular psychoactive drug. I think probably the most consumed drug in the world.
Yes.
And because it's consumed on such a large basis, I think people think it's inert.
Yeah.
And we consume it daily.
Yeah. I think that was one of the reasons why I wanted to look into it, because like you say, we have it every single day. We have about 2 cups of coffee, maybe sometimes 3 in your case, cups a day. And with cardiovascular disease, as we've already discussed before, being the number one biggest killer, we wanted to see if there was actually any harm or any benefit to drinking caffeine, and specifically for us coffee, because that's the main source of our caffeine.
Yeah.
Isn't it? So I think it's probably best then to sort of just do a little bit of background on caffeine. So what is caffeine and what is the pharmacology of it?
So caffeine is related to a class of medication or drugs called methylxanthines. So they are normally used in, bronchodilation. So theophylline is the main medication that comes to mind when I think of methylxanthines.
Yeah.
They do have a mild diuretic effect because they block reabsorption within the kidney. And in the case of caffeine, it blocks the actions of adenosine. So adenosine is actually, the receptors are present on every cell within the body.
Yeah.
And by blocking the effects, you are going to oppose what adenosine does, which is normally to slow the heart rate, dilate the vasculature, and then it would be to constrict the respiratory tract.
Yes, and then also I think the main one is to induce sleepiness, isn't it? So obviously if we are given caffeine, that's what is mainly associated with the benefits of caffeine, is that it exerts wakefulness, and so it helps you be more alert, and that's how that works. So we did just discuss a little bit before in terms of the sources of caffeine. So coffee being the main one and the most widely consumed source of caffeine. But what else where else would you find caffeine?
Tea.
Yes.
So, that's just normal tea within tea bags. We normally get herbal teas that are caffeine free. And it depends on what plants and what tea leaves, where the origin of the tea leaves are from.
Oh, I didn't know that.
Yeah, I can't remember the name. It's some really long Latin name, but I'm not going to go through it.
Okay.
And then we've got energy drinks, which are becoming more and more popular. Red Bull was the main one back in the day.
Yeah.
And then now it's got Monster, Ghost, and all these other brands that are coming into it. Pre-workout for a lot of people who go to the gym. And then we've got soda.
Yeah, so the cola nut, I think is a plant, which I think Coca-Cola is derived from. I don't actually know whether it still contains the cola nut actually, or whether that was just historically.
I wouldn't know.
But that does contain caffeine, and then also the cacao plant.
I can never see it properly.
Which is where we get chocolate from. So actually dark chocolate does contain some caffeine. I don't think milk chocolate does, potentially because it doesn't contain enough cacao, probably, in order to have enough amounts of or a significant amount of caffeine. But yeah, dark chocolate is definitely one of them as well. So in terms of then the content of caffeine within these different
they
products
change depending on where you look and how you sort of brew it yourself. So if you make a cup of tea, for example, I think the average is about 50 milligrams of caffeine.
Okay.
And if you leave the tea bag in longer, like certain people, you didn't like your tea bag.
No, I'm literally in and out.
In and out. But if I left it in for a bit longer, for me, I'm going to get a higher amount of caffeine because it's being diffused within it.
Okay, that makes sense.
Yeah, the average latte that you get from Starbucks, Costa, wherever it may be, they're getting about 150 milligrams of caffeine per latte because it's a double shot of espresso.
Right.
Then you've got normal filtered coffee, which is about 100 milligrams a cup. And then we've got energy drinks. So I think Red Bull was 80 milligrams in a can.
Yeah.
I think that was 250 mils.
Yeah.
Then we've got 160 milligrams in a can of Monster.
Yeah.
And I think I went up to 200 milligrams in Ghost.
Yeah, so that was the highest amount of caffeine that we found in the energy drinks. I always remember actually when I was a kid, my mum drank Red Bull. I don't know why, but
Because it gives you wings.
yeah,
I should edit that out.
but I always remember when I was a kid thinking, oh, I really want to try it. But my mum, this rule that we weren't allowed to have any caffeinated drink until we were 12. So I don't think that actually is a rule in terms of like she used to tell us that was like the guidance and that she couldn't give it to us until we were 12. But yeah, like we will get onto, it was probably because it does exert some effects, and so she didn't want us to obviously get the effects of caffeine.
Which is fair enough.
Yeah.
And then you've got pre-workout, which has 300 milligrams of caffeine per serving.
Mm-hmm.
Again, a serving is what's recommended. I know people who double up do other things with it.
Yeah. So as we know with all drugs, there is a certain limit that we have on them in terms of what there is a toxic dose, isn't there? So when we look at caffeine, studies that I found was saying that anything above 1 gram a day, you were getting some kind of adverse effect from caffeine. And then the toxic or lethal dose was about 10 grams, so 10,000 milligrams a day. Did you find anything different?
I think I've seen adverse effects above 1.2 grams.
Right, okay.
But yeah, around the 1.2 grams was something that was coming up.
And I think with caffeine, it's very individual, because we know that some people are fast metabolizers and some people are slow metabolizers, and that's all to do with where coffee is metabolized within the liver and the enzyme system that it's metabolized by. So, you know, I think it's sort of, again, one of those individual things where I know that for me personally, I think I must be a fast metabolizer of caffeine because I get the effects of it.
It'd be the other way, wouldn't
it? Is it the other way?
I think so, yeah.
Is it so it's not like the metabolites of caffeine then that exert the effects? I don't know, but I definitely feel the effects of caffeine.
A lot more than me.
A lot more, yeah. And so I can have, like my maximum is 2 cups of coffee a day. Anything after that, I will start getting really shaky. I can feel like my heart rate increasing. And I definitely do not sleep at night if I drink it after a certain time, whereas you don't really feel the effects as much.
I think it is, if you metabolize it fast, you are less prone to the effects.
Right, okay.
The only reason I say that is, for anyone who's interested, caffeine's metabolized by CYP1A2, which is also acted on through smoking.
Okay.
So you find a lot of smokers have this enzyme elevated.
Yes.
And if you have someone who's a smoker within your family, you'll know they're able to drink a lot of coffee, tea without any effects.
Right, okay.
And it's because they're able to clear it quickly. And I think I've naturally got that predisposition anyway, because I can have a double espresso and then go to bed. Yeah.
I know, I definitely just can't do that. It really does affect me, and I think it's always affected me. I think I also have the same, I don't know whether it's the same enzyme system actually, because I'm like that with codeine, where I get the effects of codeine.
2D6.
Is it?
Yeah.
Okay.
But it's the same thing, it's polymorphisms of an enzyme, isn't it?
Okay, so I think that we did struggle a bit this week in terms of actually looking at caffeine and its effects on especially the cardiovascular system. The reason being is that a lot of the studies are what we call observational, aren't they? So it's very difficult to ascertain whether the results from these studies are attributed to caffeine and its effects, or whether it's other confounding factors.
Yeah, so a lot of the studies that you look at for caffeine are mainly related to coffee.
Yeah.
And as we know, coffee's got a lot of beneficial effects anyway because of the coffee bean, and not necessarily just down to the caffeine content. Now, before we actually started recording this, I looked at another review, and then it listed quite a lot of studies where they just use caffeine in its pill form. Yeah. Again, from reading that, they said they only looked at it in terms of exposure to the caffeine pill once.
Right, okay.
So the studies wouldn't have been over a long period of time. But yeah, it's hard to see whether the beneficial effects are due to coffee or caffeine itself.
Yeah. So like Lee said, most of the studies are studied in coffee drinkers, and that's where the source of caffeine is coming from. So yeah, I think it's best to maybe just talk a little bit about the composition of caffeine and specifically within coffee. Okay. So the actual caffeine that you get within energy drinks is exactly the same type of caffeine that's in coffee. However, we know that obviously coffee is a bean, it's a plant, it contains fibre, and then it also contains different polyphenols, of which the most abundant is chlorogenic acid.
Okay.
So I had a quick look into chlorogenic acid. It's not just within coffee, but it's also in olive oils, some fruits and also some vegetables. But it is an antioxidant. And so that means that it sort of mops up all the free radicals that cause cellular damage. So we know that antioxidants are obviously good for the cardiovascular system. And so if you are drinking coffee, like you just said, it could be the fact that coffee contains these polyphenols that exerts its positive effect on certain outcomes.
Yeah. I mean, we have got decaffeinated coffee, and I looked into how that's formulated. It was actually found by chance. I think it was the early 1900s. There was this German who was head of a coffee company. I think it was like KAG anyway. They received a shipment and it was flooded with seawater. And then they found that the coffee bean remained intact with its taste, but then had no caffeine in it.
Yeah.
So then they went from there to try and extract it. So they used other processes. I think it was benzenes, which then were found to be carcinogenic. And then the Swiss come in and started using water, which is, I don't know whether that's the method we use today, but we can use carbon dioxide.
You said that was
highly expensive.
Yeah.
And then there's this water filtration. But the idea is caffeine free, I think, is a term that's used if it's got 97%. Well, 97% of it is decaffeinated, I think. Yeah. So it's never truly caffeine free.
Yeah, that's a really good point, because when you do look at the studies, although they're actually not as large as the caffeinated coffees, we are seeing the same results in terms of outcomes and positive outcomes with decaf and then also caffeinated coffee. So it does point towards the fact that it potentially is not the caffeine within the coffee bean that is causing the positive effects, and it is the actual bean itself.
Yeah.
Okay, so then with regards to cardiovascular health, there are a few different things that caffeine affects within the body. So the first one is blood pressure. So we know that once you've drank coffee, in a lot of studies, it suggests that it can increase your blood pressure. I personally, when I was looking at the studies, it was saying that it increased it between 5 millimeters of mercury to 3 to 5 millimeters of mercury. So it's only a very slight increase. However, obviously, it still is an increase.
I found similar.
Did you? Okay.
And we actually done it ourselves.
Yeah.
We're going through a prescribing course for anyone who doesn't know. I've specialised in high blood pressure.
Yeah.
You're specialising in?
Primary prevention of cardiovascular disease.
So we've been doing manual blood pressures, and then we done the caffeine test the other day. It did go up. I think your systolic number went up by about 3. Yeah. My systolic number stayed the same, but my diastolic went up by 3 to 4. Yeah. But then we looked into what happens if you do consume coffee over a prolonged period of time and become classed as a habitual drinker. Yeah. And it's this idea of homeostasis within the body. If you are accustomed to a certain exposure, your body will try and manipulate it because it knows it's coming. Yeah. So with caffeine, I think the blood pressure over, I think it was like 6 months, didn't really change. It did initially, but then the body expects it, so it tries to, whether it down-regulates receptors or uptakes the metabolism pathways, I don't know.
Yeah, no, I've seen exactly the same thing, and all I would say on the point of the blood pressure is that from the studies that we've seen is that it's very negligible, the increase. However, there was an increase in especially people who are not habitual drinkers. So if you have a predisposition to hypertension, or if you've been diagnosed with hypertension, then I think I would just be mindful of actually consuming caffeine, especially in larger amounts. I think from the general gist of all the studies that we've looked at, 2 to 3 cups a day doesn't seem to have a detrimental effect on mortality or cardiovascular disease or anything. But I would just be mindful of it if I was that particular patient. Did you agree?
Yeah, I think there was a couple of studies that I actually looked into with blood pressure, and if you had no blood pressure problems, there was no concern with a couple of cups of coffee a day. But then if you had a predisposition or you were actually diagnosed with high blood pressure, then you did have not negative outcomes, but you were more predisposed to risks. Yeah. And there was a study done in Japan that had about 18,000 people. Again, this goes back to how poorly run a lot of the studies are. So this one was, they took a blood pressure reading at the point of the study, so one reading, and then they asked them to record again in retrospect when they drank coffee and how much they drank and at what times. Yeah. So it come out that those who drink one coffee or less a day had no increased risk of cardiovascular disease, mortality, whatever it may be. If you had 2 or more, it increased it significantly.
Yeah.
And again, when you look at the point that it was only measured the blood pressure at one point, it could have missed a lot of people. And
yeah.
how do you interpret that?
I think as well, I don't know that it was the same study where it was mainly done in middle-aged men, which is what a lot of scientific studies tend to be done in, really. And I don't want to be stereotypical by saying this, but if I think of all the middle-aged men that I know, they're in quite high stressful jobs. And so, again, it's one of them factors in terms of, was it the actual caffeine in the coffee that was causing this mortality, or was it the fact that they just had stressful jobs in the first place, that they needed to consume more caffeine, in order to stay alert or awake during the day? So
unless you remove them from that environment, put them into an isolation cell, paid for them to be there, you would never find out truly.
But I think, maybe the point on blood pressure, and again, the point in all of these things is, if you're drinking coffee purely for the taste, we know that now decaf coffee is very well extracted, and it tastes as good as normal coffee.
Yeah.
And so if that is the sole reason for having it, then maybe 1 cup of a morning, and then the rest of the day use decaf might be a better option for, specific cohorts of people.
Yeah, I mean, we don't do it for the actual effects of caffeine. I mean, like we said before, it doesn't actually affect me from what I perceive anyway. But the only reason we have caffeine is because we've got a coffee machine, and the decaf is only in a single.
Yeah.
So it just doesn't have the volume.
I know.
I've got nothing against the taste. I would go for decaf if it would be. That's a good one. I think before we go on to the next one, you talked about 2 to 3 cups a day being enough.
Yeah.
Now, the FDA, who are the Food and Drug Administration in the United States, they sort of put out a study and a guideline of what's acceptable as a dose.
Right, okay.
So 400 milligrams a day is what's considered to be safe across a lot of individuals. Now, those who are predisposed to cardiac disorders, they should have their dosage in milligrams individualized.
Okay.
So, for example, my dad, he has decaf now.
Yeah, he does,
Apart from when he comes here, actually, ironically, we give him caffeine. But everyone else is 400 milligrams. I think 200 milligrams was classed as safe for those who are pregnant.
Yes, I did. Yeah, you did tell me that, actually.
But I personally would remove any potential risk. So why have something if there is a potential crossover?
Yeah, I think
they've deemed it to be safe.
Yeah, I think the risk with pregnancy was that it can increase the risk of miscarriage, isn't it? And then it can increase the risk of low birth weight babies. So yeah, I think it's one of them things. It's very individual, for the mother who's carrying the child. But I think for me, like I say, decaf nowadays is so accessible. It tastes as good as normal coffee, and so I probably would opt for that.
Yeah, and I know we've done like a full circle, and we did start with the pharmacology of caffeine and adenosine, but adenosine does build up throughout the day.
Yeah.
The one way we mainly clear it is via sleep. So when we have caffeine for the sole purpose of creating alertness, which it does do, the studies completely back the idea that if you have caffeine prior to exercise, you have improved physical function, and if you have caffeine prior to any mental arithmetic or any activity, you do have a better output. But if you're having it for that sole reason, you are borrowing energy, because that adenosine will eventually occupy them receptors.
So that's why you can get the caffeine crash.
It is. So that's why there's a lot of things going around with when should you have your caffeine. There's this consensus of 90 minutes after you're waking up, because cortisol is high. So you have already got a stimulus to be alert.
Yeah.
So by adding caffeine in, it's not really going to accentuate it anymore. But when that cortisol drops, you can then add the caffeine in, offsets it a bit more.
Yeah.
Makes sense. Yeah. But then we like a morning coffee.
Yeah, I think that's one thing that I just enjoy it's like we say, I don't really do it for the alertness or the wakefulness. Maybe subconsciously I'm thinking, oh, I'll be more alert, but I do genuinely just like the taste of coffee, and it's something that I enjoy. I don't drink anymore. We don't really do anything that you would associate with, being poor health. And so that one thing of having a coffee of a morning is my risk versus benefit.
Well, ironically, the consensus is that caffeine's quite good for you in terms of cardiovascular disease.
Yeah.
As we'll get on to. But I just thought it would be quite important to say caffeine does offset adenosine for the time being, but adenosine will come back. And if you keep doing it, you only just sort of paying back a debt eventually when you go to sleep.
Yeah. Okay, so then I think we should move on to the next one. So the next one is the effect of heart rate and arrhythmias that caffeine has.
Yeah. So we use adenosine to treat anyone with a very fast heart rate or an arrhythmia. So given caffeine, you are going to basically induce a faster heart rate. And it was shown, there was studies of pre-workout, which we'll get onto later, and caffeine in general will increase your heart rate prior to exercise. And sometimes that's good because you want to be alert, you want to get the most out of the gym. But then if you're sitting at rest or you have other mental health problems such as anxiety, having a fast heart rate with no output in terms of physicality, for me, is no benefit.
No.
There's no reward from that.
I think that's probably the biggest one actually, is the fact of, or the implication with anxiety, because we obviously give beta blockers for anxiety, which is to slow the heart rate down. And then obviously if you're having caffeine or taking caffeine, it's doing the opposite. And so it's just going to put you in a more heightened environment. And then in terms of heart rate on physical activity, for me, I actually have experience with this in terms of I used to have a morning coffee and then I go for a run. Now, my heart rate does get quite high, to be honest, when I go for a run, because I just find it really difficult. And it was coming to the point where it was hard for me to run, because my obviously heart rate had gone up with the caffeine, and then it was going up even further with running. And then I found that actually removing that morning coffee and then waiting until after I'd ran, it made it so much easier for me. So it for me personally, you know, like I said before, it's very individual, but it wasn't beneficial to me. It was actually hindering my performance by having caffeine.
I think that's a good point, because a lot of people will do zone 2 training, and if you're having caffeine prior to the gym, I think that's different, because you're going to lift heavy weights, long breaks in between is the general format of anyone's gym routine. But then if you're going for a run to maximize zone 2 training and aerobic capacity, if you've elevated your heart rate by, I don't know the actual values, but let's say by 5 to 6, you might be running a bit less to get the same heart rate. So your physical performance is actually the opposite way when you're doing aerobic activity.
Yeah, I think probably when you're using it, like you say, for weightlifting and weight training, there is studies that do suggest that it is beneficial for that, and that output and things are improved. But when you're doing it for cardiovascular health, you know, to build that up in the gym, it probably isn't as beneficial, because like you say, you're not going to be in the correct zone because it's artificially being put there.
Yeah.
So that is a good point. So in terms of arrhythmias then, so one of the main sort of arrhythmias that it can cause, well, is QTC, isn't it? So QT prolongation.
It has been linked to higher level, increasing the time. I think it was by 15 milliseconds.
So that's not actually an arrhythmia in its own right, is it? But it can increase the risk of arrhythmias.
It can.
Yeah.
Just hard the points.
Yeah.
I can never say that.
French. So it was shown that it did increase QTC. Now, there are certain medications that can already prolong your QTC, and then also certain underlying medical conditions that can. But in terms of the medication, I would say the main ones that a lot of people will take are citalopram or escitalopram. So that is known to increase the risk of that. And then also things like clarithromycin, which is a commonly used antibiotic, or fluconazole, which is a commonly used antifungal. So again, there is a full list of all the drugs that can increase your QT if you just type it in online. But I would be mindful, some antipsychotics as well, they can do it, and also antiarrhythmic drugs. So
with the QT, for context, it increases it by, I think, 15 milliseconds is what we were seeing. Now, the value that we look for is anything over 500, you're at a great risk of arrhythmias. Then anything greater than 440 milliseconds, these are for men, and greater than 460 for women. These do change slightly depending on where you're looking at them. And for those who don't know what a QT interval is, it's basically when you have a heartbeat and it goes from the top 2 chambers to the bottom 2, you have what's called a refractory period. So it allows the body to sort of prevent a beat happening in that time. If you expand that too long, there's an absolute refractory period and an effective refractory period, I think, from memory. I haven't looked at this. But basically, if you increase that time, you've got another chance for another heartbeat to fire off in that time. So then you can have another heartbeat going in, and then that's where your rate increases, and that's where the arrhythmias come from.
So the torsades, the point that you just mentioned, is a ventricular ventricular tachycardia. So it's where the bottom two chambers are just like firing off, and it can be fatal. It can be treated if it is obviously found, but it can be fatal. So you just don't want to get into that position. And yeah, so just like by having caffeine with any medication that you're taking or any underlying heart condition, I would speak to your cardiologist and also just be wary of it. You would find out if you have a QT prolongation through an ECG.
Yeah.
So that's just a monitor that they'll put on your heart, and then you get a trace. It'll usually be read by a cardiologist or a specialist who can read an ECG. I used to be able to read an
clinical
ECG,
pathologists. I used to be able to read them actually in
but
uni. I took a course,
yeah,
and we just don't use them.
no,
But one thing I do want to make clear is that caffeine, more than likely in less than 400 milligrams a day in a healthy individual, will not lead to QTC prolongation
Yeah.
to the point of causing arrhythmias.
yeah,
I think that's one thing I want to
we
make
do
clear.
need to make that clear.
In theory and pharmacology-wise, physiology-wise, it will increase your risk. So if you are taking a medication or you are at a predisposed risk anyway,
Yeah,
err on the side of caution,
yeah,
as with anything.
yeah. And I think that's just an important thing as well, is that if you are on one or more of these medications, you should ideally be getting an ECG at least every year
Ideally.
anyway. So
It gets missed.
it does get missed. But hopefully you'll know sort of what your QTC is if you're taking any of them medications. So
Yeah. And I've actually known a couple of people, not who's had
yeah,
QTC prolongation, but there's a couple of close friends and builders who they were just getting a lot of palpitations, a lot of, I think one of them actually did develop an arrhythmia called atrial fibrillation
Yeah.
anyway, and they were wondering what had happened to the routine, and he'd literally just bought a proper coffee machine with the espresso, and he was having 2 or 3 of them a day as opposed to 1 to 2 normal,
yeah,
sort of, what did they call it, like Nescafe.
yeah.
And then it just led to palpitations. He stopped it and it completely reversed it.
That is an interesting point actually, because we did a podcast last year on atrial fibrillation, and we know that there's actually an increase or a rise in the number of cases, especially in young males, isn't there? Which you wonder whether it's to do with the fact that a lot of people do take pre-workout now, which has obviously got quite a significant amount of caffeine in.
Pre-workouts, and also coffee culture's changed in the UK. We've got a lot of Starbucks now. Years ago, that was not the case.
Yeah.
You'd go to a cafe to have a cup of tea on a normal coffee. Now there's so many places to go and get fancy coffees, lattes, and you just don't see the caffeine content. You just see a nicely decorated drink.
Yeah. And then with regards to arrhythmias as well, just to sort of touch upon this, a lot of wearables now, the newer ones, are actually quite good at detecting them.
Yeah, they're not bad.
So, if you obviously do have any anxiety over the fact that, if I drink, coffee every day, if you are wearing a wearable, it usually will pick it up. They're not 100% accurate, but obviously it puts your mind a little bit more at ease. And like we say, it's not an absolute that you're going to get these, and it's rare. And if it does occur, it only increases it very slightly, the risk. But obviously there is still a risk, and so it's just being aware of it, really. And I think this is what all these podcasts that we do is. We're not telling anybody to do anything. All we're trying to do is just give people the information and the scientific evidence that's out there for then you guys to go and make your own decision on what you want to do. And I think at the end I will, like we usually do, we'll say what we're going to do going forward with regards to our caffeine intake.
Yeah.
Just for the listeners. So I think that's probably summarised heart rate and arrhythmias quite well. So then the next point that I wanted to get on was sleep and how caffeine affects sleep. Now, I did just say before that it affects my sleep hugely, and I've actually been tracking my sleep a little bit more, not with any wearable because we don't have one at the moment. However, we do have a journal where it basically asks you to track your sleep every day, and I have found that if I have a coffee after probably about 12 o'clock in the afternoon, I don't get a very restful sleep, and it is very disturbed, and I wake up the next day feeling quite tired.
Yeah, so that's probably linked to the half-life of caffeine.
Yeah.
Give or take 4.5 to 6 hours is what I've seen.
Yeah.
So that means after 12 hours, you've got 25% of the caffeine still in your body. Yeah. Now, I mean, in terms of me getting to sleep, it doesn't affect me getting to sleep, but I want to trial over the next couple of weeks whether stopping my caffeine content after 12 in the afternoon, whether that leads to a more restful sleep, you just said then, because I've got no issues getting to sleep. Whether the quality of sleep throughout the night changes, I don't know.
Yeah, well, apparently, so I did quickly look at this, so I haven't looked at it in any detail, but apparently caffeine does affect your REM sleep, which is the restful sleep and the sleep where a lot of sort of restoration and repair occurs within the night. So yeah, it could be that you are getting to sleep with caffeine, but you're not actually getting a good quality sleep. And I think the only way to really know that is to wear something like a Whoop, which does track it pretty well from what I've seen.
But
Or
I always
having
have a lot of dreams anyway.
I know you are quite good at that. I never
Thank God.
dream. I
I
don't.
can't force it.
Yeah,
It just happens.
I know you do every night, really, but I don't often. Yeah, I really dream. But yeah, no, with regards to sleep though, we know that sleep is obviously a very important factor in overall health, especially cardiovascular health. So, you know, being able to get a good night's sleep and recover and rest is very important for our overall health. So yeah, I think,
That's how it ties in with cardiovascular disease as well.
yeah,
It is important.
it is really important. Okay, so then the last thing that we just maybe wanted to touch upon was the fact that caffeine is used a lot for performance enhancing, so it's used in the gym. We did just discuss about this before, but I wanted to discuss it in terms of, obviously, we know that exercise is good for cardiovascular health, so whether that's weight training or, you know, cardiovascular work. So if you are using caffeine to enhance your performance, is that beneficial?
I know what you're saying. Is the caffeine offsetting the benefits
Yes.
of a workout? I've never had a pre-workout before,
No, I haven't.
ever. And going 300 milligrams in a serving, so 2 lattes in one go, and some people double them up. Plus also they may be having a coffee in that period of time. So they could be consuming a large amount of caffeine going into the gym to raise the heart rate even more. I don't see that as beneficial. And I always had this belief, again, it's just my belief, is that if I need to pick myself up to go to the gym, there's a good chance I probably shouldn't be going because I might injure myself. That was sort of my belief.
Yeah.
And also, it had this idea of dependence. If I have it every time I go to the gym and I go on holiday or somewhere else where I don't have access to that pre-workout, psychologically, I might think, oh, well, actually, I can't do a workout today.
Yeah.
But in terms of, from a medical point of view, should you be taking it before the gym? I personally don't think so. I just think having such a whopping dose of caffeine, I know people are tolerant to some extent if you take it a lot of times, but if you're having that with the idea of increased heart rate and blood pressure, plus the intense workout that you're going to be doing, I just think that's not logical for me.
No, I would agree. And I've never actually had pre-workout either. I've obviously had a coffee before I've gone to do a workout sometimes.
Yeah.
But like I just said before, in terms of my running, it was not beneficial for me. So yeah, I don't think.
One thing I wanted to look into, but I didn't get time, was how much per serving can you get away with before any adverse effects. So we're saying 400 milligrams throughout the whole day as being classed as safe. I have seen 1 to 3 milligrams per kilo per serving being where you should stay within.
Yeah.
So if you are 100 kilos and you have a 300 milligram pre-workout serving, that seems to tie in with that. But then what are you going to do when you go home? You're having more coffee, sugar, I don't know, soda and all these other things.
Yeah.
It doesn't make sense to me.
No.
I thought you were going to say something else.
Oh no, sorry. But yeah, so I think we've probably touched upon everything that we wanted to touch upon. Is there anything that you want to say before we wrap it up?
I think we need to look into this again.
Yeah, I think so.
Because my idea on caffeine, because we set out to do this podcast because we wanted to see, should we adapt our lifestyle? And going forward, that's how we want to look at podcasts. Yeah. If we can implement it in our lives and then give advice to other people for them to take it on board, that's a different thing. Yeah. I still feel conflicted about caffeine. I feel at the moment coffee is the main beneficial factor in this whole equation. I don't feel as though it's caffeine per se. Yeah. I know there's, for one study you find saying caffeine's good, you'll find one saying it's bad. Anything increasing your heart rate without physical activity, loading skeletal muscle, joints, I don't see as beneficial. I know that we did with saunas, and I know that seems paradoxical, but at least you are inducing vasodilation and all these other effects as opposed to just increasing.
Yeah, and we also said as well, in terms of, obviously you said before, the half-life of caffeine is 4 to 6 hours, which means that caffeine stays around in your body for a long period of time, whereas if you are in a sauna and then you're out of it, you've got maybe 20 minutes where your body then returns back to baseline. And
that's
so
quite
you're
a
not,
good point.
yeah, and
you can turn on and off the exposure.
Yeah, so I think that might be why sauna is beneficial over, having caffeine.
Yeah, and there's quite a lot of other studies that we didn't look into. There was one in terms of coffee itself, with it having, if it's unfiltered coffee, it can increase your cholesterol through these other chemicals, which I can't remember the name of.
Was it
ditryptines? I can't think, but they're present in unfiltered coffee. They are involved in the cholesterol synthesis pathway. There's quite a lot of things leading to cardiovascular health.
Yeah.
But I think the main things are caffeine does increase your blood pressure, does increase your heart rate, it does increase physical output, does increase mental output. Can be, they say it's not addictive. I think, well, you can develop tolerance to it.
Yeah, so it's not actually classed as an addictive substance, in terms of, like, it's not licensed as that or labelled as that. I know what you mean.
But again, I think it's because it's nicely dressed up. A latte is quite a nice drink, isn't it? As opposed to, I don't know, a needle of heroin. But it is, I think, and the same with alcohol. Off topic, that's why it will never get banned, because if you go to a bar, we went the other day for a family meal, and I went and got the sparkling water on the bottom shelf, and then on the top shelf there's all these nicely lit up LED bottles. That's never going to get stopped. But yeah, I just wanted to make a point that there's quite a lot of studies that we didn't look into. There's hundreds, thousands.
Oh yeah, and there always is. But we have seen a positive correlation with cardiovascular outcomes, all-cause mortality outcomes, with people who drink a couple of cups of coffee per day. And it suggests that it is actually to do with the coffee bean and the polyphenols within the coffee bean, the fibre within the coffee bean, that is producing that effect, rather than the actual caffeine within it.
That's what I take from it. So going forward, what are you going to do?
So going forward, I think, like I said, because I personally really see the effects of caffeine, or feel the effects of caffeine, I've stopped actually over the last couple of weeks, just even before doing this podcast, having coffee after 12 o'clock. Now, I did have one today because I don't drink alcohol anymore, and so over weekends I actually enjoy having that extra cup of coffee, but probably tonight I will suffer, and then it'll be like, why did I do that? But obviously for me, it's more beneficial for me to drink a cup of coffee than to go out and drink alcohol, because that's going to affect my sleep and my health way more than a cup of coffee is, if it's just a one-off. But yeah, so I was already doing that in terms of not drinking after 12. I was having 2 cups of coffee a day. I think I'm going to try and maybe reduce it to 1 cup just in the morning, and then for my second cup of coffee, have decaf coffee. And then even if I did then switch to decaf coffee, I feel like I could potentially then have a third coffee in the afternoon if I really wanted to.
Yeah.
Because the only reason I don't is because I do feel the effects from it. Like I said earlier, I will get tremors. I actually suffer with an idiopathic tremor anyway, which is where my hands shake. So it's heightened and I get tremors. I feel nauseous is like a really big one for me. And then I can feel my heart rate going. And then I get like hot flushes and things. So I really do get affected by it. So yeah, I think 1 cup in the morning, and then switching to decaf then for the cups after that. What about yourself?
We asked this last time in terms of what we were going to do with food, like as though you don't cook all my meals.
I know.
This is the only job I actually do in the house properly, is I make the coffee. So I asked you, but I'm still making it for you. So in the morning, I'm still going to have my coffee.
Yeah.
I'm probably going to have 2 cups at least a day.
Yeah.
I will try and have them before 12. If we can get a decaf capsule, by all means, I'll have that instead. It doesn't affect me. I'm not doing it for the effect, because I don't feel any effect from it.
Yeah.
And when I go without coffee for days, or even a couple of weeks when we were away once, it doesn't really bother me at all. I don't get withdrawal from it because I must metabolize it quite quick. But that's what I think I'm going to do.
Yeah.
And I do agree. I think it's more the coffee than the caffeine. But until I look into it more, I can't categorically say.
But I think that is the end of the podcast. Thank you so much to anyone who's got this far. And if you haven't already, then please subscribe to the channel, as it really helps us. And then also, if you actually know anybody who would benefit from listening to either this podcast or any of the other podcasts that we discussed, then please send it on to them. But yeah, thank you so much for listening, and we'll catch you at the next one.
As always, this podcast is for informational purposes only and should not be used in substitute to seeing a medical professional.